I love what I do. It's a big responsibility and a privilege to take care of people and help guide them to thick and thin, to the good and the bad, and being born into life or the end of life.
All right, well, welcome to the Developing Doctor Podcast. I'm Ben Reinking, your podcast host, pediatric cardiologist, and physician development coach. And this is a place where we're bringing the heart and soul back to medicine, and growth never stops. And I'm really excited about this episode today because we are interviewing 3 doctors at different phases in their career, and they all happen to be my family members. And so you'll get to learn about what happens in our household kind of behind the scenes a little bit. But it's also going to be really great for people to listen to just like the whole arc of medicine and what people think towards the end of their careers as well as in training. So it is my pleasure to introduce the Doctors Geick. So Dr. Lynn Geick is a family medicine with 30 years of experience in family medicine. Dr. Jenna Geick is a neonatology fellow in her second year at the University of Iowa. And Dr. Griffin Geick is a third-year emergency medicine physician in Corpus Christi. And we're going to talk about why they chose their specialties, what they love, what they maybe like less, and what surprised them and where they see themselves in the last 5 years. So thanks so much for putting up with this podcast interview, guys, and welcome. Lynn, let's just start with you. Let us know a little bit about where you're at now and kind of where you did your training.
I'm in my 30th year of family medicine. I love what I do. Started my training at a residency program here in Iowa. Ended up staying in Iowa where I've been in the same practice for 30 years. A lot of changes in technology over those 30 years, but overall, at the end of the day, I enjoy my patients and I enjoy what I do.
I bet your patients love that you've been there for that long. I think it's rare in medicine sometimes to have the same doctor for that long, so that's awesome.
Yeah, they almost come like be extended family members. You get to know them, you know how they act, how to push them, how to help enable them to get good outcomes for that. So it'll be hard to leave someday when I make the decision to hang it up just because of the relationships I have over 30 years.
And Jenna, kind of after that, where are you at right now? How'd you get there and where did you train?
Yeah, so like you mentioned, I'm in my second year of neonatology fellowship here at the University of Iowa. I did medical school here, but I went away for a little bit to do residency at Michigan. And I'm so glad to be back home for this phase of my training. In terms of how I got here, so I think I kind of always knew I was going to go into medicine. I don't ever remember looking back at a time in my life where I thought I was going to do something else. I'm sure there were times where I thought I was going to be a hairstylist or a teacher, but really, when I look back, I always knew I was wanting to be a doctor. And I think a lot of that actually comes from my dad. From a young age, I really got to kind of experience what it was like to be in medicine. I remember when I was younger going to the hospital with him so he could round on his patients and getting to see babies in the nursery with him. So I think it was just kind of always ingrained in me that this was something that I wanted to do, and just getting to see the relationships that he makes with his patients and the impact that he made on his life. I knew that, or on his patient's life, I just knew that was something that I saw for myself.
That's awesome. Way to have a positive influence there, Lynn. And Griffin, how about you? Where are you and how'd you get there?
Yep, so I'm finishing up my third year of emergency medicine residency down in Corpus Christi, Texas. So before living in Corpus, I actually had lived in Iowa my entire life. And, I guess I'm the one family member who decided to move away from Iowa. And, I've been down here in Corpus Christi and I've really enjoyed it. It's been a great 3 years. But kind of, how I got here, kind of echoing off of what my older sister said, I did really, appreciate everything that my dad did growing up. I was able to see the impact that he had in the community. And Dad, I promise I'm not just saying this because it's close to Christmas time. I actually mean it. Just the positive impact that he was able to have on the community. And, everyone's like, oh, your dad's Dr. Geick. He's such a great person. He's such a great human. It really showed me how that physicians, how they're valued in the community and how they can have such a positive impact on people's lives. And that really, it stuck with me from an early age. And I wanted to have that same impact on my community someday.
That's awesome. I'm sure that feels good to hear that, Lynn. So I'm just curious, what drew you to family medicine, and did you think that what you do would impact your kids in the way that it did, or were you worried that it would maybe scare them away from medicine? Or
real interesting because growing up, I guess I learned my empathy and how to treat people with my parents. I owe them a lot of my core beliefs. And, my grandparents got sick and in the hospital with them, I kind of got my first exposure to medicine. I thought, hey, I want to do this. And I looked at many other fields, but I always came back to being a doctor to help take care of people. So I love what I do. It's a big responsibility and a privilege to take care of people and help guide them through thick and thin, through the good and the bad. And being born into life or the end of life is just such a unique experience for that. I tried to leave a good example for Jen and Griffin, and gave them lots of options. I had never said you have to become a doctor because they kind of figured that out on their own. I did tell them to become orthodontist or become a dentist when I was frustrated in the middle of my career with the hours and the paperwork. But they saw through that, and they're both very successful. It makes me very proud that continuing on what my parents taught me as far as empathy and how to take care of people.
Yeah, that's awesome. I mean, I think we underestimate the impact that you have like at home, especially as a physician when you're busy and you probably feel like, you're not giving as much as you can to life at home. And it has to feel good to hear that you gave what you could and that it meant a lot.
I remember just growing up in my practice. I mean, the kids were probably 6 and 7 or 5 and 6, and we'd go to the office at night for me to do paperwork, and they'd have races on the exam tables or stools running around the clinic. I'd be there for an hour and two, and they just loved it. They had fun running the hallways and not being too mischievous. But that's the memory I have when they're little, taking the hospital with me, or when I'm on call, taking them to the office to do paperwork. So pretty special memories I have of that.
That's awesome. So, hearing of how much Lynn loves his career and kind of family medicine, was there anything about it that kind of influenced Jenna and Griffin, like the careers that you chose, or did you find your paths kind of completely independently in medicine? I mean, how'd you choose neonatology and how'd you choose emergency medicine?
So I have always had a passion for taking care of kids. Throughout middle school and high school, I nannied for a family, kind of watching them grow up from birth up until I left for college and things like that. I'm probably the odd duckling in the family in terms of my dad and my brother. I Old people are just not for me. I've just recognized that I really like getting to kind of experience life from the get go with families, from when their baby takes that initial first breath and they're coming to the NICU, whether it be for something like extreme prematurity, which is a very terrifying moment for families, understandably, but then also if their babes come into the NICU just for hypoglycemia, that's equally as terrifying for new parents. And I just feel like it's such a privilege and an honor to get to walk through those terrifying times with families and get to be there with them every step of the way. You really get to build unique relationships with those families, especially the ones that are there for months and months. And it almost feels like, in a way, like you kind of become part of their family. You understand what they're going through in ways other
Mhm.
family members can't for them. And it's such a privilege for the relationships that we get to make. And there's still some families that I talk to intermittently that I took care of during residency and sometimes thus far in fellowship, just to see how things are going once they leave the
Mhm.
hospital.
Hopefully, man, older people other than your dad.
Yeah.
That's what Griffin's for.
Yeah.
That as soon as
As the
you're of
other
age, we're putting you in a home. So
As the other pediatrician on the call, I can totally relate to what you're saying, Jenna. And
Yeah.
I thought it was really interesting. I mean, a lot of the values that drew you to neonatology are kind of similar to what Lynn talked about
Mhm.
family medicine. So yeah, that
Yeah.
really speaks a lot. And Griffin, emergency medicine is kind of different in some ways from, family medicine and neonatology, but I suppose in other ways, like some of the intensity that Jenna talked about is still there. So how'd you wind up in EM?
yeah, so I kind of had, when I knew I was going to go to medical school, I was like family medicine all the way. I'm going to do family medicine. And then I got to my rotations third year, and I absolutely hated it. I just wasn't a fan of the 8 to 5 every day, and just seeing all those seeing the same patients every day. It wasn't appealing to me. So I kind of took a big 180. I feel like, going from family medicine to emergency medicine. I never thought I would like emergency medicine, but I fell in love with it in medical school, and I continue to love it more and more every day in residency. And I think just you have patients and family members that family members are bringing their loved ones in for emergent life threatening things. It's not always emergent life threatening, but to the patients and the family members, to the family members, it feels like it's emergent life threatening. So I think one of the things that I enjoy the most about emergency medicine is being able to provide those patients and their family members comfort in a time of what they think is a life emergency. And, in some cases it is, but just, being able to provide them comfort and say, hey, I understand that this is a very difficult time for you and that your loved one is sick, but, our staff and, us here in the emergency department, we're going to do everything we can, to
Mhm.
get you guys through this over the next, 3 to 6 to 8 hours, however long they may be in the emergency department until we can get them, to their next place in the hospital, whether that be to the cath lab. I hope if they're going to the cath lab, it doesn't take them 8 hours to get there. But cath lab or angio suite or, just admitted to the ICU for
Yeah.
DKA or, some other, severe derangement. But, I really do enjoy that initial step of, when family members come in, freaked out that something's really wrong and, you're able to calm them down and say, hey, he's sick, but we're going to take care of him and everything's going to be okay.
Yeah.
And then,
That's,
and then all the
that's kind of
procedures
a,
we do are fun as well. But
yeah. It's kind of, people sometimes talk about emergency medicine as one of the downsides is that you don't get to know patients, but it sounds like you really do establish relationships with patients. It's just very different than it would be in a family medicine office or not, and still very patient facing and patient centric kind of.
yeah, I mean, I've ran into, I mean, I don't remember the patient just because we see, 30 to 40 patients a day on some days, I don't remember all the patients, but, I've had patients come up to me at, HEB or Target, and they say, and they recognize me and we're thankful for the care that I gave them or their loved one. And, that really does hit home to me, being able to have that positive an impact on somebody and, the 5 to 10 minutes you spend talking with them in an ER bed.
Yeah, that's awesome. So, Lynn, one of the big challenges I think healthcare faces is that there's just a shortage of primary care providers and primary care physicians in particular. And what do you think needs to change to draw more people to family medicine and to sort of allow primary care physicians to sort of be like the primary care physician that I remember when I was growing up, where it was an office where I knew everybody and they were there the whole time, and the physicians owned the office and it was their practice. Like how can we change and get back to that model?
When I first started, it was that family practice model. You saw your patients, you saw newborn babies in the hospital, you'd admitted patients over your lunch hour, after work, in the middle of the night. That has slowly transversed over, 30 years to now we just do outpatient medicine. We don't see newborn babies in the hospital. Technology is a big point. A big burden of family medicine is the paperwork, the phone calls. I'm kind of at the end of my career, but I think there'll be a big benefit from technology, from AI to doing notes to doing automatic lab things, answering phone calls. I think that will help. I think the big corporations, insurance companies, can be negative, but can be positive. They have the financial support. It got us through COVID, which we would never survived on our own if we weren't part of a health network or a health system. So that's been helpful. But I think also reimbursement's a big issue. Family medicine really struggles, every year to make budget because we're just not reimbursed that well. You do a surgical procedure or you do something, read a CT, and, they do that in a few minutes and we spend 45 minutes with a patient and, our health system gets paid nothing. So we're always struggling to, how do we code better? How do we do this better? What are other ways to get revenue in? I think that's draining. So that takes away just from just practicing medicine and taking care of the patient. But it's something you got to realize to deal with. And the younger new providers just seem to say, "Oh, it's just the way it is." They haven't seen all the different changes that I've seen. But I think technology would be a big help. I think reimbursement needs to get figured out that kind of put us all on the same tier, just so we can continue to take care of patients.
Yeah, and I like that perspective that people that are entering the field don't know what it was like before. So it's maybe some of the things that frustrate you now don't exist for them because they just didn't know. That's a good. I hadn't thought about that before.
And most family offices now are, outpatient medicine. You have a hospice, do the hospice work. So, the new guys don't know about, admitting patients in the middle of the night or taking care of newborn babies or getting called. I mean, we don't even get that many phone calls anymore compared to what we used to. So, I guess now we focus on quality of measures, which we have a lot of help to do that, which is important. Reimbursement, people help us with that as well. But it's just different from what it was than several years ago. Not all bad, not all good, but it's just something you learn to deal with every day as you do your job. And the underlying factor is you take care of your patients. That's the most important thing.
So, Jen and Griffin, you're both relatively close to medical school, and one of the things I hear from students a lot is, how do I pick what I'm supposed to do? And it feels like they have all of this pressure to decide what they want to do. And thinking back, was it hard for you to pick your specialty, and did you feel pressure? And how did you end up figuring it out?
Yeah, I think for me, I'm a little bit of a odd duckling in that, and I always knew I wanted to do pediatrics, so I personally, I never really struggled in terms of trying to decide what I wanted to do going into residency. I think what I had more of a challenge with is what was I going to do post-residency, because like I had said, I'd always
Mhm.
dreamed of being a pediatrician,
Mhm.
and then once I made it there, it's like, "Oh my gosh, what's next?"
Mm.
And I think something that I kind of realized is I could be happy doing a lot of different things within the field
Mhm.
of pediatrics, but it was what was I going to enjoy even on the more challenging days? And looking back, I'm so glad I chose the field of neonatology over other fields that I was considering, because the days where we have bad outcomes, patients die, yes, it's really hard, but I'm still really excited to go to work the next day and continue
Mm.
to learn from my patients. So that's something that for the medical students and residents that I work with these days, that's something that I tell them to find.
Mhm.
Because if you don't have that within your field, it's going to make those days more challenging. And there are going to be days where you don't want to come back to work.
Yeah, that's really great advice. I mean, the good days are easy no matter what you're doing, but
Mhm.
the bad days aren't. And how do
Yeah.
you recover from the bad days? And then, yeah, it has to be something that you enjoy and kind of aligns with your values, I think. Yeah.
Yeah, I think that's pretty,
Um,
spot on with what Jenna said. I mean, yeah, maybe there's some days that I don't want to go to work for other reasons, but I always enjoy I always enjoy when I'm on shift. I always enjoy it. And I think that's the biggest, I think, maybe challenge to find initially in medicine, when you're,
mhm.
unless you're like my sister, who knew she wanted to do, pediatrics from the time she was maybe 2 months old. But
Yeah.
but it is, because in medical school, when you're going through your rotations, you're so stressed about, doing good on your, in training exam for that block, performing well in the rotation so you can get a good grade, blah, blah, blah. But, in the long run, yeah, it is important to have good grades, but really you need to be able to see what you enjoy in medical school through your
Mhm.
rotations because, like I mentioned earlier, I really
Yep.
thought I was gonna be a family doc, and I was really excited for my
Mhm.
family medicine rotations, and I got there, and after the first day, I was like, "This is not for me. This is not how I wanna spend the rest of
Yeah.
my life."
Yeah.
So, I think just going out there and experiencing things and, learning firsthand, putting yourself in those situations of different specialties that you think you might like or you think you might wanna, pursue more is very important because, you're able to see what a day in the life is like as an ER doc, as a surgeon, as an anesthesiologist, etcetera, and it allows you to kind of see if you can do this for the next 30 years, which, and that's kind
Mhm.
of how I ended up with emergency medicine is I could see myself doing it and I loved it. And yeah, and I'm happy to go to work every day. I love my job, love taking care of patients and their family members. So
And I
Yeah, I
think
think that's
just to
very
kind of
important. I think it's very important what Jen and Griffin just said is you've got to love your job because it's a toll some days. And I'm been there 30 years. I have partners that don't like their job and they hate going to work, and you can tell it that they're not happy, they're grouchy, they're irritable, they don't enjoy taking care of their patients, and it's a struggle for them. But they feel like they're stuck. So I think what you guys said is very important. Find something you love because there are days you don't want to go to work, but once you get there, you love taking care of patients, and that helps get you to work. And before you know it, 30 years and you're ready to retire. So I'm glad both you guys, all three of you guys, have found something that you love doing. So that's very, very important. Great advice.
And I think just to kinda echo off of that a little bit, more specific for medical students and residents too, it's just keep an open mind, you never know where life is gonna take you. You might come in thinking you're gonna do pediatrics or whatever, your interest is, but really find a niche in something else that you didn't know that you would want to just because you haven't had the experience to it. So I think it's just really open, or it's really important to keep an open mind to allow yourself those opportunities, just because if you go in with a closed mind, you kinda never know what you could be missing.
Yeah, that's such great advice. And I'm wondering, Griffin, when you realize that, oh, I don't want to do family medicine, like, was there a sense of panic, like, oh shoot, what am I gonna do? Or like or that you were gonna let your dad down by doing something different? I mean, was there a moment where you just thought about, oh, I'm just gonna plow through and do this, even though I don't think I really want to do it?
looking back on it, I probably should have panicked a little more than I did. I'm sure that's a shock
Mhm.
to all of you guys that I didn't think it was a big deal at the time. Um, but because my first rotation in medical school was emergency medicine, I just kind of went in there like blah 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 blah. It's gonna be fun. I'm gonna maybe do some sutures, and that's about it. my family medicine
Mhm.
blocks next month. I'm looking forward to it. But, I did have an open mind and, I really loved that month. And then I went to family medicine and I was like, man, I'm like throughout the day, I'm like, I'm yawning. I'm struggling to stay awake. So maybe the more panic in the fact that I didn't realize I was gonna like emergency medicine as much as I did, but I think the fact that I wasn't,
Yeah.
like, gung ho on family medicine starting was a big impact as well. Because I think if I was and I didn't enjoy that rotation as much, I'd be like, "Wow, the next 30 years of my life is gonna be miserable because I said when I told everyone I'm doing
Yeah.
family medicine, I have to do it, but, I was able to, kinda work back and, do some more thinking and soul searching, you could say, and I fell in love with, emergency medicine, and I was able to, continue with that path.
That's
And I
awesome.
think something that Griffin kinda highlights there is, like, it's okay to change your mind, this is a career
Absolutely.
that you're gonna be doing for the next 30, 40 plus years, and it needs to be something that you enjoy, and, like, it's so much easier said than done, right? But, like, you have to do it because you want to and not because there's external influences telling you to do that. I'm sure my dad would have been thrilled if Griffin chose to go into family medicine, but I also know how proud of Griffin he is for finding
Yep.
something that he's truly passionate about.
Yeah, absolutely. Well, so
And
kind
just
of
to
the
seem
same.
excited about that decision, and he's thriving now and loves what he does. So that's awesome that, good advice, keep an open mind and go through every rotation thinking, hey, is this for me or not? And there's no urgency to decide immediately on day one. So take your time and figure it out because it's a life decision.
Yeah, absolutely. Well, kind of the same question for all of you right now. So, the first one is Griffin, you're a new dad. Jenna, you're going to be a mom soon, which means that I guess Lynn and I are grandpas now. And so what's one thing that you hope like the baby Geiks or baby Scott, I guess, take from what you do every day, and kind of what's one lesson they hope they take from your professional identity?
I think, the
Griffin,
one
since you beat me to having a kid, you can answer this question first.
I think, the most more important thing that I want Cameron to take away from, my career, treat people the right way, be kind to every single patient that comes into that you
Hmm.
see because, that they could have a million external factors going on in their life. They're scared, they don't know what's going on with them medically,
Hmm.
and they might lash out at you. But, just I hope he is able to see that, I have been kind or that I try my best to be kind and thoughtful and treat every patient as if they were a family member of my own because, I feel like that's our job as physicians. And that's also should be, our job to, our neighbors and, everyone in our community is be kind to everybody. I feel like it's a lot easier to be kind than to be angry and, lash out at other people.
Yeah.
Um, it seems really simple and, some days it's not simple. I can vouch for that, but, just again,
Yep.
just I hope he's able to see that how important it is just to be kind to every person that you encounter in your career and in your, life.
Wow. I don't think anybody else needs to talk. Like that was the best advice.
How am I gonna follow that answer? But I think for me, the biggest thing is I want her to be proud of me, like the way I am proud of my dad. I look
Suck
up to
up.
him in ways that Hey! No, but in all honesty though, like my dad's one of my biggest supporters and they're with me every step of life. And I want her to be proud. I want her to have the passion for doing what she does, whether it's in medicine, whether it's not. I think just finding that passion is something that's really important in life.
That's awesome. Yeah.
I think too, something that when Griffin mentioned about being kind is, you may see 30, 40 patients a day. So it's routine for you, but that patient only sees one doctor a day, and that's what they're going to remember. So you almost got to treat every patient you see, even though you be tired or frustrated or upset. But their one interaction with you. They don't have 30 doctors that day. They have one doctor that day, and it's up to you to take care of them, be kind to them, and to listen. Listening is a very important skill, whether it's in medicine or at home. Listening and being kind will get you a long ways in life.
Yeah, absolutely. Well, kind of one last question that I just like to ask everyone that's here is what's one thing you're looking forward to in the next few months to years? Your jobs are hard. You pour a lot of yourself into your patients and your career. And what's one thing that you're going to do to recharge and reset so that you can show up every day and be kind and be the best version of yourself?
I'll go first. totally different from my perspective from Jen and Griffin's, but I'm excited about being a grandpa to Cameron. We're excited about being another grandpa come February to baby girl Scott. So that's very exciting for us. And actually, it's going to be kind of hard to step away. I've been doing it for 30 years. So I wonder, boy, who's going to take care of my patients? What's going to happen to them? What am I going to do? Am I going to be bored or that type of thing? So them are my new worries, but I'm sure my family will help me get through all those things.
I've got a list ready for you of things you can keep busy with.
Babysitting. I think for myself, I'm just really excited to see how my perspective changes once I become more than just a dog mom, and just how I'm able to kind of relate to patients' families differently. And I'm just really hopeful that it kind of brings a new way about connecting with patients, because that's one of the things I really pride myself in is, just making those small connections with families that are everlasting. So I'm excited to see how becoming a mom changes how I practice.
Awesome.
Kind of to, wrap things up with that question, I guess. I'm, in my last year of residency. I'm excited to be done with residency finally. I'm not doing any more training. I am done with postgraduate education. Postgraduate education forever. So I'm excited to be attending. My girlfriend Chelsea and I, we're going to be moving a couple hours more north in between San Antonio and Austin for our new attending job. So we're excited for that. And, I'm excited to see the next year to 2 years, watch Cameron grow and, see how he will continue to have a positive impact on my life. And just in kind of what Jenna was saying, see how he continues to change the way I interact with patients.
That's
I'm
awesome.
excited that they're both going to be finishing their training and really be off my budget totally if that ever happens. So yes, Jenna, when you become attending, I'm not paying for your cell phone anymore. So buckle up.
No, I'm saving you money, Lynn.
Well, thank you guys so much for sharing your experiences and perspectives and for putting up with me as I did this podcast episode. It was fun just to listen to you as professionals, but as well as family members and learn a little bit more just about your purpose and kind of what you see yourself doing in the future. I also hope that people that are listening got to hear a little bit of themselves in your stories, and if there are any students or who are listening, got a little insight into how to choose their specialties. So thank you so much for joining me on the Developing Doctor podcast. For those listening, if you like what you heard, you can help us reach more people by subscribing and giving us a 5-star review. And to learn more about what we're bringing or how we're bringing the heart and soul back to medicine, visit our webpage at thedevelopingdoctor.com. Until next time, stay curious and thanks for listening.